But what about the individuals who still want kids in the future, but also have low testosterone that they want treated? Well, this video is for you, so keep watching. So, in my most recent video, I talked about how TRT used to treat low testosterone can lead to infertility in men. And that's because it suppresses sperm production. If this is new information to you, go back to my last video. I talk all about it and break it down. Now, for men who are done having kids or have no interest in having kids in the first place, this is largely a non-factor, and we can go ahead and proceed and give them TRT. But what about the individuals who still want kids in the future, but also have low testosterone that they want treated? Well, this video is for you, so keep watching. The first thing you should know, if you are a man with symptomatic low testosterone who desires treatment but also wants kids in the future, is that you may inherently have a more difficult time conceiving because of the lower levels of T in the first place. Lower levels of testosterone can decrease sperm production in the testicle. In my practice, I recommend a baseline sperm analysis on any man who still wants kids but is found to have low testosterone. That baseline lets me and them know what they are starting with. So if the individual chooses to get their low testosterone treated but still wants kids, I offer them one of two methods. One, add HCG with the TRT. HCG, or human chorionic gonadotropin, is similar in structure to LH. Again, watch that last video if you're confused. LH, remember, is responsible for intratesticular testosterone production, so testosterone production within the testicle. And this is critical for sperm production overall. So giving HCG can preserve sperm production even in the midst of exogenous or medical testosterone from TRT. Second option or method is using clomiphene or Clomid. Clomiphene, which is FDA approved for female infertility, is a selective estrogen receptor modulator, SERM. SERMs increase spermatogenesis or sperm production by blocking the negative feedback that estrogen has on GnRH. Okay, let me just recap. Remember, my last video I talked about how hormones are regulated. Hormones in abundance, testosterone or estrogen, will negatively feedback on higher level hormones in our pituitary gland and in our brain. So that means when there is a lot of estrogen or testosterone around, this inhibits the production of LH, FSH from our pituitary and GnRH in our brain, which lowers the production of estrogen and testosterone in the first place. It's like turning down thermostat because you're too hot. That abundance of heat that the thermostat was producing led you to turn off that production in the first place. So, SERMs like clomiphene block this negative system in the brain. The thermostat stays on even in the abundance of heat. This allows more testosterone production to happen because GnRH from the brain is not suppressed. This not only increases testosterone production from the testicle or intratesticular testosterone, but it also increases spermatogenesis or sperm production. Clomiphene basically is a trick. It tricks your body into thinking it doesn't have enough testosterone or estrogen, so it must keep producing more. Okay? It's a trick. And it does this by tricking your brain. And your brain then tells your pituitary gland to make more LH and more FSH, leading to more testosterone and more sperm production from the testicles. So those are the ways that we can maintain fertility and treat men who still want kids in the future who have low testosterone. All right. So let me know what you think in the comments. Hope you learned something today. Make sure you like this video. Make sure you subscribe. Make sure you tell a friend to tell a friend to tell a friend so we can all get more information down there right here. Okay? Bye.